Hello, welcome back to my channel. In my previous video, I discussed the qualities that make a normal vaginal discharge. And today, we're going to be discussing abnormal vaginal discharge. What are those things that you will see that will tell you that this vaginal discharge you're having is abnormal? If you are keen to learn about this, watch this video with maximum attention.
This is Dr. Habib TV.
So, these qualities include 1. When the discharge has any color other than clear or white, green, yellow, gray, all are abnormal colors for vaginal discharge. 2. When the discharge is thick or cordy or cheesy. 3. When the discharge has a foul odor. 4. When the discharge is bloody. 5. When it is associated with itching of the private part. 6. When there are other symptoms like fever, pain in the lower abdomen or private part, pain on urination, abnormal vaginal bleeding, and so on. Having discussed the qualities of abnormal vaginal discharge, it is important to talk about those things that can cause abnormal vaginal discharge for someone. The first category is infections. Infections can be from bacteria, can be from fungi like candida, they can be from trichomonas, they can be from gonorrhea. It can also be from other sexually transmitted and non-sexually transmitted infections. The second is presence of abnormal growth within the vagina, the cervix, or even the womb. This is commonly seen in cervical cancer. So, that abnormal, persistent, and difficult to treat vaginal discharge may be symptoms of cervical cancer or any other form of cancer within the reproductive tract. Number 3, it may be a reaction to irritants such as soap, antiseptics, douches, sprays, latex condom, and so on inserted within the vagina. Number 4, it could also be from retention of foreign substance such as tampons, condom, and so on within the vagina. Now, what are the problems that can occur from having a prolonged abnormal vaginal discharge? First, the infection can climb from the vagina into the uterus, then through the tubes to access the pelvic cavity. This can lead to recurrent chronic pelvic pain. It can also lead to the formation of pus within the pelvic cavity, which will require surgical operation to cure. Secondly, the infection within the fallopian tube can form wound and scar within the tubes. This scar within the tube can disturb the passage of the developing newborn from the tube into the uterus. The developing baby then gets stopped in the tube, forming what we call ectopic pregnancy. In addition to scars that can be formed within the tube, pus can also be formed there, and the combination of both will lead to blockage of the tubes, leading to difficulty getting pregnant. Number 4, wounds and scars formed within the uterus can cause the inner lining to melt and adhere together. This in turn can lead to disruption in normal menstrual pattern and also difficulty getting pregnant in the future. Number 5, prolonged vaginal discharge in pregnancy due to infection can lead to preterm labor, miscarriages, and infection for the newborn. Number 6, infection can cross from the vaginal opening into the opening of the urethra just in front, where urine flows out, causing problem with urination. Number 7, prolonged infection of the vagina and the cervix can lead to formation of wound within this area. These wounds can be a precursor for the onset of cancerous formation If the discharge is coming from a developing cervical cancer and it's not taken care of in time, it can lead to the spread of the cancer from the cervix to other parts of the body. So, what should you do when you have abnormal vaginal discharge? The first and the most important thing is to visit a good hospital and see a qualified doctor who can make an accurate assessment of the condition. This will give room for the doctor to take a detailed account of the discharge, conduct a thorough clinical or physical examination, and take a sample of the discharge for laboratory testing. This will be very important in prescribing the best treatment option for this discharge. Stop taking antibiotics and inserting all sorts into your private parts. Seek proper care for that vaginal discharge that has refused to go.